How are you? My name is Shanelle. It's nice to meet you. Thank you for this opportunity to come in and interview with you all today.
How's your day?
It's going good. How about yours?
Good. So I'm just gonna ask you a couple questions and then just answer them to the best of your ability, okay?
Okay, sounds good.
What inspired you to pursue a career in the NICU as a new graduate nurse?
Great question. So I'm drawn to the NICU because it combines highly skilled nursing with compassion and patience. During clinical rotations, I connected deeply with newborn care and was fascinated by how even the tiniest interventions can make a huge difference. And I realized I wanted to work in a setting where attention to detail, calmness, and empathy mattered every second. Caring for the most vulnerable patients, because every patient is valuable, right? But the little ones are the most vulnerable, and it motivates me to be the best nurse that I can be.
Nice. What strengths do you feel you bring to such a high environment like the NICU?
I believe that I bring a strong observation skill, a calm demeanor, excellent communication. Uh, I'm very thorough in detail, which is essential when working with neonates, in my opinion. I also learn quickly and respond to feedback. In stressful moments, I stay focused on the task and communicate clearly with my team to ensure safety.
Nice. What would you do, or what if you notice subtle changes in a baby like distress, feeding, or jitterness, but their vitals are still within normal limits? What do you feel you would do?
I would definitely trust my clinical observations. In the NICU, small changes can signal early distress. I would first reassess the infant to confirm that I noticed, document it clearly, and then notify the assigned nurse or charge nurse immediately. I'd explain the changes, compare them to baseline behavior, and stay close by until we determine the next steps.
Nice. What if a parent became emotional or anxious and asked you questions you didn't know how to answer? How would you respond?
Good question. I would definitely stay calm and listen fully, and make sure that I validate their feelings. I would be honest if I didn't know the exact answer, but I would definitely reassure them that I would find out. So, for example, I would say something like, "That's an important question. Let me check with the nurse practitioner so I can give you accurate information." In my opinion, this shows empathy, professionalism, and respect.
Nice. What if an infant's oxygen saturation drops suddenly? What would your immediate steps be?
Oh my gosh. Hopefully this never happens. But I would quickly assess the infant's airway and make sure that they're breathing and positioned properly. I would ensure the equipment is functioning correctly and stimulate the baby if appropriate. At the same time, I would call for the nurse or charge nurse and communicate the situation clearly. My priority would be maintaining airway support and responding promptly to prevent deterioration.
Nice. What if two infants needed your attention at the same time? How would you decide which one comes first?
Woo! You're throwing it at me. It's okay. I would prioritize based on acuity. The infant with a life-threatening or rapidly changing condition will come first. So basically, take them based on severity. I would immediately communicate with the team. NICU care is never done alone. So it takes a village for sure when dealing with children or trying to raise children. So I delegate when possible to ask for help so both infants receive safe and timely care. Knowing when to call for support, in my opinion, is a key part of being a new nurse.
Nice. Tell me about a time during your clinicals when you had to stay calm under pressure. What did you learn from that?
In one rotation, a newborn experienced respiratory difficulty shortly after delivery. The room became very busy, of course, but I focused on staying calm, following instructions, and watching the team's communication. That moment taught me the importance of keeping my emotions steady, speaking clearly, and acting quickly. It reinforced the remaining calm. It reinforced my understanding that remaining calm helps protect the patient.
Nice. What if you notice a gradual downward trend in an infant's vital? Not an emergency, but concerning.
Hopefully that won't happen either. But I'm glad that we're addressing different scenarios. I would treat trends just as seriously as sudden changes. I would reassess, compare the data with the previous readings, document the trend, and notify the nurse immediately. In the NICU, early prevention can prevent a crisis, so I wouldn't wait for a critical value or for the condition to worsen. I'd also prepare for potential interventions while staying close to the infant.
Nice. So NICU parents often feel scared or powerless. How would you support them as a new nurse?
Great question. I would definitely approach them with empathy and patience. I provide information in simple, clear language, ask if they have questions, and help them understand their baby's progress step by step. I reassure them that their feelings are normal and that our team is here to support them. A calm, caring presence can make a huge difference.
Nice. Good answer. Why do you feel you're a strong fit for the NICU position as a first time nurse?
Well, I believe I'm a strong fit because I combine compassion with attention to detail and willingness to learn. I'm committed to safety, teamwork, and excellent communication. I understand the emotional and technical demands of NICU nursing, and I'm eager to grow. Understand the guidance. I'm willing to grow and gain knowledge and try to understand the guidance of all of the experienced nurses. My goal overall is to provide excellent care to the infants and support their families during an incredibly vulnerable time.
Nice. Thank you.
Well, thank you.
Thank you. That's all the questions I have for you today.
Awesome. So I'll just wait for an email or follow up.
So we still have a couple other people to interview you, but you should hopefully expect a call within the end of the week.
Well, awesome. I hope
Thank
that
you.
I'm given an opportunity. Thank you again, Monica, and I hope you have a wonderful day.
Okay.